Yeah, your birthday.
Can you see that all right?
Yes. Okay. So my case, it's pretty easy to figure out what was going on, but it made me interested on resistance. Okay. So there was a 67-year-old male who came in complaining that he couldn't breathe at all. He presented with shortness of breath, general malaise that began a week ago that has progressively worsened since then. He has a significant history of COPD. He normally uses 2 liters of oxygen, but where he had a hypoxia, we increased it to 4 liters in the hospital. And really the only surgery that he had was on hand surgery. I just kind of picked the most pertinent and have write down all of it for the things, but his social history that I thought was most pertinent was that he was a current smoker with 50-pack years. He drinks 3 or more alcoholic drinks a day, and his comorbidities were COPD with emphysema, asthma, history of gout, history of headaches, history of hyperlipidemia, hypertension, osteoarthritis, stroke, recurrent sinusitis, and history of rheumatic fever. His vitals, 138 pounds, didn't have a fever, pulse rate was 128, blood pressure was 134/74, and his oxygen was 94%, which wasn't too bad. And the pertinent physical exam was the patient appeared short of breath and in moderate distress. The lungs had bronchi, which were heard best in the upper lung fields bilaterally. He had sinus tachycardia. He had signs of infection, and he had the chest x-ray when we did it had showed a right-sided interstitial and airspace disease, and they said it was most likely due to pneumonia. And then after we cultured it, we treated him empirically with fluoroquinolones first, but once that turned out that it was resistant, we switched to piperacillin. And his medications, he has many COPD drugs, and he also had amlodipine, aspirin, Lasix, potassium, lisinopril, and Prilosec, and Lovenox. Additionally, in the hospital, we gave him lidocaine, methylprednisolone, metolazone, nicotine, where he wasn't smoking during that time, and then nystatin and Zosyn and sodium chloride. But yeah, that made me kind of interested for like how common is this fluoroquinolone resistant Pseudomonas. So I looked it up. The CDC says about 15% of cases of Pseudomonas are actually fluoroquinolone resistant. And where this person was in like serious distress, I wonder if that's like the recommendation, if they are in serious distress, if you just treat it like as if it was resistant, or if you keep it like just try the fluoroquinolone first. That'd be interesting if anyone has recommendations on that.
Great job, Denise, and thank you so much for the case and going through that for us. Does anybody have any questions?
Great job, Denise. I will say something that can be interesting about Pseudomonas and really all the bugs is that their resistance patterns can actually be quite different depending on where you are in the country. So for example, up at OSU, actually most of our Pseudomonas is resistant to Zosyn. And so it really depends on kind of the institution and where you're at. And most hospitals have something called like an antibiogram or something like that, where you can look up actually all the different bugs, what they're typically resistant to, and it can help you pick your antibiotics. But that was a great talk.
Yeah, that was interesting too, because when I was discussing with a clinician, he was just like, yeah, we've seen recently an uptake in like the fluoroquinolone resistant. And like you're saying, I guess it's just dependent what's going on at that time in the location.
Thank you so much. Do you have any other questions, Denise, or does anybody else have any comments about this case before we go to the didactic?
I just wanted to say thank you, Denise, for bringing a case to CLD Echo. We haven't had one in a while, and so seeing something like that is just so interesting. And we just truly appreciate your time and presenting. So if anyone has any comments or have seen similar cases, I'm interested to hear about that, because I'm not a clinician, so I can't comment on anything like that, but it's just so interesting to hear. So, you know, Kim, Aaron, any of you have some further comments or something you've seen similar, would be really interesting to hear. Thank you.
Thank you so much, Mitra. I echo what she says. You see echo a lot. All right, well, if you do later, please do it in the chat. That's completely fine. Are you ready to share your screen now?
I am.
Perfect.
All right, so let me see. Your screen. Ooh, this is kind of strange. Oh, it's telling me I have to quit Zoom and reopen. It's kind of odd.
That's odd, really, when you scan the bottom and hit share screen just for that.
Yeah, so I hit share screen and then I go to desktop. Oh, hold on. Wait, maybe.
I think you're okay. I can see it. Just
Can you see it?
Yeah, just perfect. If you go into that.
Okay.
There we go.
Can everyone see it?
Yes.
Okay. I was like, I've never gotten that message before.
Yeah, no, I haven't seen that. I was like, uh-oh.
All right. Well, I can go ahead and get started then. So thank you, first of all, everyone, for having me. I really appreciate it. My name is Alexis Monison. I am in my final year of Pulmonary and Critical Care Fellowship up at OSU, and I will soon be joining faculty at University of Utah. My interests include air pollution and occupational lung disease. So I have no financial disclosures. As a disclosure in general, I'll say I'm working from home today and I have 2 dogs that are very excited by Zoom calls. So if you hear barking in the background, I apologize. So our outline today is we're going to be talking about an intro to air pollution, do a little bit of a highlight of the literature review. I didn't want this talk to just be kind of study after study after study, but I did want to just highlight some of the studies and give you some tools that if there are other cases, it can help you look them up later. And then talk a little bit about patient counseling. So what is air pollution? It's really the presence of toxic chemicals or compounds, and that includes a biological origin in the air at a level that pose a risk to human health. This is actually a really great infographic that I like from the World Health Organization, and it talks about the different sources of air pollution. I think before I started to learn about air pollution, I'd sort of assumed, you know, air pollution comes from things like cars and industry, but really it can come from a variety of different sources. So agricultural practices is actually huge in the United States, but there are other things like household energy. So this would be things like burning of biomass, tends to be very common in other countries. Otherwise, waste management, that would be an example of that would be, again, basically burning of biomass and other products of war. This tends to be a very large issue for a lot of our soldiers coming back from the Middle East. Transport, of course, cars, and then dust as well. So depending on what part of the country you are in, areas that are very dry, very dusty, that also contributes to air pollution. And this includes other things too. So this also includes other environmental sources of pollution, volcanic eruptions being a large one, depending on where in the country you are, where in the world you are, that can be more or less significant. And this is just a reminder that air pollution is not a localized process. So this is actually a map of the jet streams that cross the United States. And you can see in the United States, we have 2 major jet streams. And really, so air pollution that is released in one part of the country or one part of the world will then be brought to other parts of the country and other parts of the world. So when we're thinking about exposures and things that are released into the atmosphere, you can't just think about your local area. You have to think about really broadly what is being brought in. Now, when we look at air pollution, it is typically categorized into a number of different types. So we think of what we call criteria air pollutants. Now, the criteria air pollutants are pollutants that are both regulated and routinely measured by the EPA here in the United States. We also have air toxics. And what that is those are chemicals that are regulated by the EPA, but are not routinely measured. And then, of course, we have everything else. Now, most of the literature will actually focus on the criteria air pollutants. One, because we know that they do have a significant impact on human health, but two, these are ones that we routinely measure. So this actually makes it a little bit easier to study some of these. So I want to just dive in depth a little bit more about these. The criteria air pollutants were really set by the Clean Air Act that was passed in 1970 and subsequent legislation. What they are is the National Ambient Air Quality Standards, or NAAQS. And what they did is they chose 6 pollutants based on, one, their presence in the atmosphere and how high levels they saw, and two, if they were particularly dangerous to human health. So the criteria air pollutants are nitrogen dioxide, ozone, carbon monoxide, lead, sulfur dioxide, and then particulate matter. And I'll get into what particulate matter is a little bit. There are measuring stations throughout the country. They tend to be fairly nondescript. I think as someone driving by, I would never really notice what they are. So I put 2 pictures just on the right of what some of these measuring stations look like. So what is particulate matter? So particulate matter is any sort of solid matter that is aerosolized into the air. It can be very heterogeneous depending on where you are in the world. So some parts of the world, it can be made up of certain things. Other parts of the world can be made up of other things. But essentially, like I said, it's solid matter. And we tend to think about it in 2 sort of sizes when we're looking at the literature. One is what we call PM 2.5. So that is less than 2.5 microns in diameter. And that's what you see in red. And then we have PM 10, which is less than 10 microns in diameter. And you can see how small that is compared to, that's a human hair in the middle versus a grain of sand. So incredibly small. And like I said before, particulate matter can be different depending on where in the world you are. This was a really interesting study that actually looked at the composition of particulate matter in various places across the world. And I think the specifics on this slide are not necessarily that important, but what is important is that you can see that the composition really varies. In the United States, I'll say that most of ours is classified as this unspecified source of human origin. If you look into kind of their details on this actual report, it tends to be actually pesticides that take up a lot of this. And so how much does this impact what we see on a daily basis? This is a photograph actually looking at Chicago from Lake Michigan. And on that day, the PM 2.5 levels were 10 micrograms per meter cubed. And then just a couple days later, it went up just a little bit. And you can see what a visual impact slightly higher levels of PM 2.5 actually cause. Now, very few pollutants are actually regulated. So we have the 6 criteria air pollutants. And again, these are the ones that are both measured and regulated. There are 187 air toxics, and these are the ones that are regulated but not routinely measured. But there are greater than 100,000 chemicals used in manufacturing every day. And these we truly don't have a lot of data on. We don't know very much about their impact on human health, how much they're spreading in the environment. There's just a great sort of unknown there. Now, how many people in the United States are exposed to these? So this is actually a study from the WHO and the EPA looking at the number of people who had been exposed to this. So actually in 2020, 96.9 million people had been exposed to one or more of the criteria air pollutants at levels that were deemed unsafe for human health. You can look at ozone, it's 79.2 million people are living at levels that are unsafe for human health, and so on and so forth. But that's a huge number of people in the United States that are living at these levels that we know aren't safe. And this unfortunately causes a lot of deaths. So actually the WHO estimates that about 4.2 million deaths every single year are caused by air pollution. This is a map estimating where those deaths occur, with dark blue being areas of higher deaths and light blue being areas of lower deaths. And you can see, unfortunately, this does impact countries that we know have very high levels of pollutants. Notably, you can see India and China are particularly affected by this, but the United States is certainly still included. Now, what are these deaths caused by? This is actually an infographic from the World Health Federation, and it's really using data from the WHO. And it's estimating how many excess deaths from these various diseases are caused by air pollution. And a shocking 29% of deaths from lung cancer, 24% from stroke, 25% from heart disease, and 43% of other lung disease deaths are impacted by air pollution. Now, for the purpose of this talk, we're going to be focusing on some of the pulmonary diseases, though there is actually a lot of data on the links between air pollution and some of the other diseases. So which lung diseases are affected by air pollution? I made a list of really the lung diseases that you can find a lot of information about if you just truly just search lung disease, air pollution, and you look for various studies. So these are ones that have been very well studied and you can find some really great data on. It's anything from asthma, COPD, reactive airway disease, pneumonia, COVID-19, ILD, and cancers. Though I will say this is certainly not a comprehensive list. And there are actually some really fascinating studies looking at some of the more rare lung diseases. One of them actually being coal miners' lung disease, which is certainly impactful for you guys in West Virginia. So I wanted to highlight just two studies that I thought were particularly well done. And I think they're also representative of a lot of the types of studies that are done on air pollution. I will say that I tried to pick studies that were original research, that were published in journals that are kind of very highly regarded. And like I said, tend to be representative of air pollution research and what you'll see out there if you're searching yourself. So the first one is looking at asthma. So this was a study done by a group at Hopkins, looking at long-term coarse particulate matter exposure in children and how that is linked with asthma. This was published in the American Thoracic Society's Blue Journal, so very kind of highly regarded journal. And essentially what they did is they used data from 2009, 2010, and they looked at patients age 5 through 20 who were enrolled in Medicaid. So using kind of national Medicaid data that is publicly available. And they looked at the comparison of air pollution and the number of asthma exacerbations and hospital admissions. Just taking a peek at kind of their characteristics. So their study table 1 is over here on the left. They're looking at, again, ages 5 through 20. I will say, looking at kind of large scale asthma research, there is not a lot below the age of 5. And for those of you who aren't familiar, there is a lot of debate of whether someone less than 5 years old can be diagnosed with asthma. I think the general thought now is that yes, you certainly can, but because of sort of the debate going on, there really isn't a lot of data available. So a lot of those folks are excluded. And they did look at patients from a variety of different places in the United States. So because this was such a large study, you had patients all living in urban areas, you had patients living in suburbs, you had patients living in rural areas. And then just a quick kind of look at their table 2. This is just a summary of the asthma events. So in a per 1,000 person years, there were 2 hospital admissions and about 31.5 ED visits for asthma. And what they did is they compared this to PM levels or particulate matter levels. The top graph is a map of the United States looking at PM 2.5 levels, and then the bottom is PM 10 levels. The black dots represent various monitoring stations throughout the country. I will say that since this study has been done, there are actually many more monitoring stations than there were back then, but at the time of the study, this is what they had to work with. And dark red, is high levels of air pollution or high levels of PM. And then this kind of lighter pink color is low levels of PM. And then they also mapped ED visits. So the top graph is a map of the United States with ED visits per 1,000 person years, blue being very low levels of ED visits and red being high levels. The bottom map of the United States is similar, but it is looking at hospital admissions for asthma. And so these were their results. So I will explain this graph is, I think, a little bit tricky to look at, but the left row is PM 2.5 and the right is what we call coarse PM or PM 2.5, PM 10. So basically the larger PM on the right, the smaller PM on the left. And this was looking at the rates ratio of various asthma outcomes. So first was prevalence. And so you can see that anything basically greater than 1 is going to be statistically significant in this. And so the prevalence of asthma increased with PM 2.5 and PM 10. Hospital admissions increased dramatically. ED visits increased dramatically. And they looked at it in basically a single pollutant model. And what that means is we are just looking at PM 2.5 or just looking at PM 10. They also did it adjusting for the other pollutant. So they're like, let's look at PM 10, but let's adjust for PM 2.5. So that's what the bottom column is. Now, I will say this study is done in a very similar manner to a lot of the air pollution studies that we have. And there's some really kind of positive and negative effects of studies like this that I just wanted to bring up. Because like I said, if you are searching the literature, you are curious about a various disease process, and you were looking for air pollution links to that, you're going to find a lot of studies similar to this. So on a positive note, the study is huge, which is fantastic. So we know that it's a well-powered study. You're looking at folks from all across the country. So that includes patients in urban areas, rural areas, and everything in between. This study in particular is great because it's looking at long-term effects of pollution. You'll tend to see that studies are broken down looking at long-term pollution and short-term pollution. And this happens to be one of the ones looking at the long-term pollution because there tend to not be quite as many of those. Now, some negatives, and I would say the negatives do kind of impact other studies of this nature and tend to be fairly similar. But studies like this don't account for individual risk factors. It is a massive cohort study and it's just impossible to know every single patient's risk factors. But things to take into account, especially when we're thinking about childhood asthma, is other comorbidities that patient is experiencing, especially one that I think of is household smoking. So this does not take into account that. Though they did actually in this particular study try and account for sort of county levels of smoking and see if they could adjust for that. May not be applicable to children who are not on Medicaid. So the Medicaid studies are done because the information is widely available, but may not be as applicable to those who are not on Medicaid. It does cause some other issues in that there are some very complex interactions between socioeconomic status, access to healthcare, and then air pollution. So I would say it's not necessarily, it can be a little bit difficult to parse those out. This study only looked at 2 pollutants, and as we know, there are tons. And this excludes patients under 5. And like I said, this is an issue in a lot of the asthma studies, just because there's such controversy about whether someone under 5 years old can be diagnosed with asthma. So the next study that I wanted to highlight is pneumonia and air pollution. So this is a short-term air pollution and incident pneumonia study, also published in the American Thoracic Society's Blue Journal. And it was looking at incidence of pneumonia in Utah, actually. And just to give you guys a little bit of a background for those who are not familiar with Utah and the Salt Lake City area, Utah in particular has a particular weather phenomenon called air inversions. And what that means is essentially that in winter, air pollutants and warmer air get trapped in these sort of bowls between the mountains. And so what you get is you get very, very high levels of air pollution stuck in these bowls. And you can actually see the picture on the left is someone who's hiking up on a trail and looking out, and you can see how that pollution is just sort of sitting there. On the right, there is a map of the entire area that is studied here, and each of the different colors represent an air basin, which is basically a bowl that the air pollution sits in. And so what they wanted to know is, does short-term air pollution exposure increase your risk of pneumonia? So they looked at patients who were admitted to a number of hospitals in that area, in the Salt Lake City area. And there were about 4,000 cases of pneumonia. Folks tended to be, for this study, a little bit older, so the median age was 58 years old. And so this is an interesting study. This is an interesting graph. I think it's a little bit tricky to look at, but essentially on the y-axis, we are looking at the odds ratio per 10 units of pollution increase. So it's essentially saying as the y-axis increases, your odds of having emergency department diagnosis of pneumonia increases. Now, lag day on the x-axis is essentially saying after some sort of exposure to pollution, do you get pneumonia on day 1 after exposure, day 2 after exposure, day 3 after exposure, 4 on 5, so on and so forth. And what this is showing is, again, anything above 1 is significant. And it is saying that for PM 2.5, nitrogen dioxide, and ozone, you can see that after a couple days of exposure, the number of pneumonia diagnoses increased significantly. And this is the same thing, but instead of looking at ED diagnoses of pneumonia, this is looking at 30-day mortality. And so they also show that 30-day mortality increases drastically after people are exposed to high levels of air pollution. And they actually did something very interesting in this study that most studies don't do, is they actually looked at the cost reduction that we would actually see in healthcare if we were to fix some of our air pollution issues. So this is basically calculating the cost of savings that we would have if air pollution levels were brought down to what we consider a safe level. And so you'd save close to $1 million a year in this one area alone. So knowing that this data is out there, how do we counsel our patients? What can we do to tell folks to kind of keep them safe, keep them as aware of this as we possibly can? Because we know that it really impacts every sort of lung disease and even other diseases that are not pulmonary. I wanted to share with you a resource that I love to use. It's called IQ Air. It is a website that is free, completely free. So you can literally just go iqair.com. You can type in your location. I pulled up Charleston, West Virginia on this one, and it will tell you your air quality index for the day. What's neat about IQ Air is you can interact with it on sort of a very simple level in that patients can open it. If it's green, good, I can go outside. If it's red, bad, don't go outside. But it can also be for those who want to learn more. You can go into this very granular level of, oh, what was the pollution on this particular date, and what were the levels, and patients can track it that way if they so desired. There is also an app for IQ Air for those who like to look on their phones. The app is completely free and it gives you the same sort of data. The data that they pull from are the same data monitors that the EPA uses. And if you wanted to, this is probably my favorite feature of IQ Air. You can actually pull up a map of the entire world, and it's kind of real time as much as possible. And it's actually showing you air pollution levels throughout the world. I pulled up, this is the United States as of yesterday. And so blue is very low levels of air pollution. Green is slightly higher levels of air pollution. So I'd say we were doing okay yesterday. We weren't doing great, but we were doing okay. A common question that you will get is, can masks protect me from air pollution? And should you be counseling your patients to wear masks to help protect them? I put up a slide here of basically masks, really the kind of highest quality masks that are easily available to the public. The one on the left, I'm sure we're all too familiar with after the COVID pandemic, is your N95 mask. And the one on the right is a KN95 mask. Both of them very easily available. You can buy them off of Amazon for not very much. And like I said, these are probably the highest quality masks that a general consumer would be able to buy. So the question is, so actually, let me jump back to this. What does this protect you from? So both of these masks are rated to something, basically 30 microns in diameter is what they filter out. So they are phenomenal for bacteria, viruses. Particulate matter is larger than that. So particulate matter gets filtered out. Allergens get filtered out. But I wanted to just give you a little bit of a comparison, because it's a little bit tricky when we're talking about tiny things to remember just how tiny some of these things are, in that they actually do not filter out gases at all. So this is a nitrogen dioxide molecule, and this is, I just picked one of the air pollutants just to show you guys. So these are basically all these measurements. You can see that it's one nitrogen that's red in the middle. The oxygens are blue on either side. And these are the measurements. So a nitrogen molecule is 155 picometers in diameter, oxygen's 152 picometers in diameter. And if you do some math, you can actually stack 432 molecules of nitrogen dioxide into every single hole in an N95. So just to give you an idea of truly how small the gas is versus the mask, the masks really do not provide any sort of protection from gaseous pollution. Other things and resources that patients will bring up and that can certainly be offered are portable air quality monitors. So there are actually monitors that are commercially available. You can buy them and put them in your home, and they will actually give you readings of, it typically is the criteria air pollutants of what the levels are in your home if you want to know. I will say there are a lot available. They tend to be quite expensive, and only some of them have actually been validated. So I put this study here. This is basically a study looking at the various devices that are available to the public and comparing them to the commercial devices that the government uses. And I would really stress that if you have a patient who's interested in this, to look up this study and really only purchase a monitor that has been validated, because unfortunately there are a lot that are very expensive that have not been validated. And I would just hate for someone to spend money on something that we have no proof that it actually works. Air purifiers are another thing that tends to come up. Air purifiers with HEPA filters are what you would be thinking about. HEPA filters, similarly to an N95, will filter out anything about 30 microns in diameter. So again, phenomenal for particulate matter, phenomenal for allergens, bacteria, viruses, but it similarly will not filter out the gaseous pollutants. They're just too small. So just to come to a conclusion, air pollution is a major public health crisis that does not get a lot of attention right now. There is a lot of epidemiological data linking air pollution exposure to a number of pulmonary diseases. I highlighted two, but truly the list just goes on and on. And patients can be counseled using a variety of resources. I will say if patients want to learn more, IQ Air, the WHO, and the EPA all have really great learning resources that if people are interested, they can certainly go to. And with that, thank you so much. I put up my email and my Twitter. I will say that my OSU email will not be active for all that much longer. So University of Utah email coming soon, but I do not have it, but Twitter will stay active. So if you have any questions and want to connect, I would love it.
So great. Thank you so very much. That was really an excellent presentation. And I'm interested on an environmental, like justice and environmental perspective. So it was really interesting to see that. And I appreciate your time. And a lot of people do not think about, air pollution in their areas, and some areas are much more aware of it versus others. So, that IQ, I put that website link up on my own side because that's a very great access and resource that we can use. And especially for those with lung issues, they can use that before they venture out if they feel that might be impactful. Anybody have any comments or questions?
Just wanted to also thank you for presenting today. It is so interesting and so important to know all this information. Like Elizabeth said, she's an expert in, compared to me at least, about environmental science and all of that. So I learned a lot today. Thank you.
Of course. Thank you again for having me. This is something that I'm really passionate about. I love talking about. And so I really appreciate the opportunity.
You can tell it resonates while you're speaking. So that's great. I love that. Does anybody have any comments or questions? Or have you come across patients that ask these types of questions, or do you think you could maybe bring this up to them if they are having, these types of issues?
I will say in clinical practice, the patients who have brought this up to me the most are folks with bad asthma. Tends to be the patient population that is really kind of tends to be in tune with their exposures because they're sort of used to, hey, I'm exposed to something and then I get sick. And so, counseling those folks is really great. And I generally, for those folks, say if it's a really bad air pollution day, if you have to go outside, wear a mask. If you don't have to go outside, phenomenal, stay inside.
Absolutely. Have you come across individuals that come later on in life and you can correlate where they might have grown up too?
Mhm.
I know like Parkersburg area where my grandma used to live in Marietta, a lot of individuals, there's a lot of like smokestacks in that area. So later on they're coming to realize how, much it impact their health.
Oh, absolutely. And there's a whole, just kind of a little bit of a tangent, there's a whole subset of patients who have COPD who were never smokers, which is something we don't see a lot here in the United States. But I have a couple folks actually from China who never smokers, but grew up in very, very high pollutant areas and now have developed really severe COPD and emphysema as a result, 30, 40 years after they moved away. So just huge issues.
Absolutely. It's pretty remarkable. All right. Well, if you have any questions, please pass them our way. We really do appreciate your time today. And thank you so much for joining us. And we'll be sending over the slides and everything later on. Thank you very much.
Thank you.
Thank you.